Here we go, a brand new edition of Sports Medicine Weekly on this Saturday morning. Hi, everyone. I'm Steve Cashel, joined by my usual co-host. So great to have him back, Dr. Brian Cole. He is the head team physician for the Chicago Bulls, one of the team physicians for the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our producer is Shane Reardon, our coordinating producer, Tracy Toro, and our website is sportsmedicineweekly.com. How are you, Doc Cole?
Steve, I'm doing great this morning. It's awesome to see you.
Thank you. Dr. Nick Verma, one of your partners at Midwest Orthopedics at Rush, subbed the last 2 weeks. He was terrific. It's good to see you back in the chair, though.
Yeah, it's great to be here, but I love the team approach, and Nick always does a great job, as does Chuck Bush-Joseph.
Yeah, absolutely. Well, Doc, let's get into it this way. It seems that everyone in the new year has some sort of resolutions. Do you?
You know, I've been, I guess it's the same one I always have and that most of us have, and it ends up being, just to be more diligent, more scheduled in terms of exercise and, managing nutrition, things like that, and especially over the holidays where it becomes a bigger challenge. But like everyone else, it gets very hard to sustain. I mean, the fact that we always have a new year and a resolution, and most people are doing the same darn thing, says that we are having a profound challenges in making lifestyle changes. My baseline's pretty good, but you and I always talk about it. You want to do better, and it becomes really difficult to sustain.
Even at the gym, where I work out, the workout facility, people laugh because they'll see all these new people in the first week of the new year, and then some of the regulars will say, "We'll just wait for a couple of weeks; they'll all be gone."
Yeah, I know. I think they probably sell 20% of their new memberships in the first 2 weeks of January. And the place is packed for the first month, and you get there in March, and it looks like it did in June the year before. So it clearly is an issue. People are motivated. They get exceptionally motivated when they say, okay, I get a fresh start. They're getting a reset. But the biggest challenge is, making a change and staying with it.
Well, let's talk about creating a vision map for a healthy 2020. No better person to help us with that than Karen Malkin, a board-certified integrative health coach and eating psychology expert, joining us from the North Shore of our Chicago area. And Karen, her clientele includes executives, professional athletes, men and women of all ages, students, motivated individuals who are ready for a new level of vitality. How are you, Karen?
I'm doing great. How are you?
Everything's good. Happy New Year to you. And
Happy healthy.
Yeah, great to have you on Sports Medicine Weekly. So let me begin with this. You help your clients with their resolutions and health goals. Why is it so difficult for most people to stay on track with their resolutions and commitments to their own health?
Well, you're right. People join the gym. They're great and really consistent for the first 2 weeks, and then they kind of drop off. And I think it's because most people, A, they're trying to do too many things at once, and B, they're not tying their goals to the big picture. And that's what the vision map does. And it really helps you articulate what's most important to you in your life and what you want your health for.
So can you give me an example? Like, I think I'm locking in, but I would want to give me an example. If I was an individual who says, look, I've had these commitments and I'm really motivated, but I just can't stick with it. I can't make a change. Is this something they put down on paper? You sit down with them over a session? How does it work?
Yeah, it's actually usually a few sessions, but I'll tell you how we start is we start with the vision map, and we sort of just like backtrack to me asking them questions or them filling out the vision map about what do you love in life and what makes your heart sing. So if you think about that question for you, like what comes up and what's most important to you and what are you most proud of?
Well, there's a lot of things that are important. But I would say if it's pertaining to health, which is one of those sort of the legs on the stool, if you will, because that's what sort of keeps me, good and solid during the day. I would say, feeling healthy, feeling strong, feeling like I'm taking care of myself, and knowing the flip side of when I don't do that, how bad I feel, especially with hours that, I do 14, 18-hour days. So if I slide in that other area, which I do, in my own mind I slide, maybe other people say, well, that's not a slide, but I would say that's an important sort of leg to the stool that can be very difficult to maintain at the intensity that I think I need at my age and with what the demands are for me, for example.
So you want to feel, you need to feel strong and vital in order to get through these surgeries and through your workday.
Yes.
And so what would need to happen in order for you to feel strong and vital on a continual basis?
For me, I would say that when the frequency of exercise and activities are good, and nutrition is pretty stable, and for me, if I could, even social drinking, if I even got rid of that, I feel a lot better. But I don't want to beat myself up either. I mean, that's hard for the average individual, and to set goal, that's probably an unrealistic goal. Maybe you're going there. But I would say for me, I know when it's right, and it's right side up. When I have the best way for me is to have a goal that I'm training for. So these climbs and things like that has been particularly useful. But you can't always have a goal like that. So I always think about the average individual who's trying to meet some goal to feel good about something from a physical perspective and has a hard time doing it because they're not prioritizing in a way that they probably need to.
Mm-hmm. Even somebody who, let's say, their goal would be just to be able to get on the floor and play with their grandchildren, but they have so much knee pain and they're, maybe 60 pounds overweight. And so the goal of changing the diet, we would have a conversation about what would that look like, and how would changing your diet, how does it tie into that big picture of being able to be with those grandchildren? So it's kind of like you really have to articulate this. You have this 4-page vision map in front of you, and the questions for you to really think about are what is most important to you? What do you love to do? And if you can't do what you love to do, then there's a disconnect. And what are you most proud of? And what do you want your legacy to be like? What is your life about? And a lot of people don't really think about these things, and many of us aren't making these day-to-day choices that are in alignment with the big picture. You're making your day-to-day choices with your exercise, with, a little bit of social drinking, but not too much, with your diet, because and you've already tied it into this is how you can work and be this phenomenal surgeon. That if you're working your nutrition and your exercise in a certain way, that you can live the life that you desire. But many people aren't living the life that they desire. And so that's where we have to articulate, what is this life? How do you want to show up? What is most important to you? And then we can talk about those day-to-day choices with processed foods, not going to the gym, kind of blowing off gym, just blowing yourself off when it's really not in alignment with the big picture. And we got to keep tying in those goals to the big picture. And that's what I continually remind my clients, and that's where the coaching takes place. And you have this core area sheet that I ask you to rate yourself on a scale from 1 to 10. How satisfied are you with your sleep? 1 to 10, your movement, your exercise, move your body in ways you love, your nutrition, your relationships. And that could be your colleagues at work, it could be your friends, your family, also your relationship to yourself, your own personal boundaries. Sometimes we have problems with, struggles with our no muscle. That was something that was really big for me when I worked with my coaching team. And then there's resiliency, your ability to bounce back from stress. Because sometimes if you're having issues with your resiliency and you can't seem to bounce back, it's no wonder you don't have a Ben and Jerry's problem. It's not about the food. It's typically about something else, or the exercise. And then your spiritual self, your connection to yourself, and where do you get that inner strength to move forward? And then there's your environment, your surroundings. It could be your office, your desk, your kitchen. If your environment is in disarray or toxic, that could also be causing unwanted challenges around food, around diet, around exercise. So we often have to kind of backtrack and start with the big picture, and then start to narrow it down to, okay, let's talk about these core areas. Where do you want to start? Sometimes people think, it's my diet, and then they realize, whoa, it's my relationship. If someone's going through a divorce, or there's some issues in relationship, it relates to your motivation to get up and exercise or to eat well, because food is pure pleasure. Why would I want to take their favorite foods away from them right now when they're really struggling and hurting in certain relationships? So we really have to acknowledge where we're at today and right here, and maybe also understand where I am right now, how it might actually be there for a good reason, but now you're here and you're willing to make a change, and we're going to make changes in very small steps, and we're going to create SMART goals. You've probably heard of SMART goals that are specific, real specific, measurable, action-oriented, realistic, and timely. So what would be like a goal, let's say, you'd set for yourself?
Yeah, so Karen, it sounds like you're functioning like a psychotherapist with the focus on sort of, life issues, for lack of a better description, helping people identify what those are, and then reverse engineering back into sort of good health, eating, exercise, and so forth. And I mean, it seems like you really are emphasizing this link between sort of the baseline psychological aspects of an individual and then trying to reverse engineer it, get back into how can I then make something, identify what you need to achieve your goals and make it stick. It's a much deeper process than I've seen anywhere else. Is that fair to say?
I mean, we peel back the layers of the onion and we go deep. And the more you can articulate, and this is through, I'm trained in motivational interviewing. And so you, the client, the patient, you have the innate capacity to heal within you. So by asking you powerful questions will allow you to have those aha moments for you to really do the healing yourself. If only given the chance. So this is sort of what I do. I love them up. I support them. And it's not therapy, because therapy, this is coaching. It starts from where you are today and we move forward. Therapy is more from, childhood. We talk about, more the past. And this is kind of like I'm meeting where you're at. This is where you're at now. Where do you want to go? I want to lose weight. I want to develop an exercise routine. I want to kick sugar. I want to improve my relationship, great. We start there, big picture, take it down, then talk about these core areas, these 7 core areas that I just mentioned, how they relate to each other. How might that relationship, if you give yourself a 3, let's say, for relationship, I might ask you, okay, what would it take to get from a 3 to a 4? What would that look like? So you really have to articulate what an improvement would look like. And I might also ask you, why did you give yourself a 2? And then you might think, okay, pat yourself on the back. I guess I'm not that, it's not that much of a struggle. I am doing some things well, because I think, affirmations and acknowledging all what we do well is really important, because we tend to be so hard on ourselves. If we would talk to ourselves like we talk to our best friend, we'd be in much better shape.
Yeah, no, I think that's a that's a common, sort of human
Yeah.
characteristic. So when it's all said and done and someone comes in, they fill out, it sounds like it's a questionnaire. Did you help, is it your questionnaire? Did you put this together, or has this been sort of validated?
This is from the Arizona Center for Integrative Medicine.
Got
This
it.
is Dr. Wiles' center, and this is the health coaching training
Got it.
that I was certified with them as well. I have a few coaching trainings. But, yeah, so this is sort of modified from the University of Arizona. And, I do this with my clients that want to do it. Not everybody. I pull from a deep bag of tricks, so not everybody wants to go deep or is ready to go deep. So, we always start with goals and how we're going to get there, and making some small changes that are like doable, that they can say, on a scale from 1 to 10, this is a 10. I'm sure I can get this done this week. And how realistic? It's almost a 10 also, because if it's not a realistic goal, to work out 5 days a week and for 2 hours, I'm going to do this. And if it's not realistic and it's got to be really important, it's not going to happen. And then you feel bad about yourself. So we start with small goals that are super attainable and super realistic and very important. And once you reach success, it becomes you. And these small step changes, 3 months go by, 6 months go by, you're completely different. You have a totally different lifestyle.
So there's 4 ways to connect with Karen. We're talking again with Karen Malkin. I have to wrap it up now. You can visit Karen's website, KarenMalkin.com, KarenMalkin.com. Email questions to support@KarenMalkin.com. You can schedule a 90-minute initial consultation. Also, you can try one of Karen's 14-day transformation jumpstart programs. Does that cover it, Karen?
That's a great ways you can reach out to me and work with me. And then I have a newsletter, and I also have Instagram and social media. I post free tips, and I have over 450 recipes that are free on my website. So
Awesome.
Have a look.
Yeah, we usually love talking with Karen. If we had another 15 minutes, Brian, I would ask her about
it makes my life a lot
the,
easier. I don't have to do anything.
Well, it's great. I love to know what I can and can't eat, and what's organic, what's not, and what's good, and the whole thing. So we'll get into that as the weeks move on. But Karen, again, thanks for joining us for Sports Medicine Weekly. And I know you did add one other certification quickly, right?
Oh, yes. I just became a Recode brain coach. I am trained in Dr. Dale Bredesen's Recode approach to help coach patients with cognitive decline. He wrote this book called End of Alzheimer's. It's fantastic. And so I'm now a certified Recode coach as well.
Cool. All right, Karen, thanks so much. Got to take a break, and appreciate it. We'll talk to you soon.
Thank you.
Karen Malkin, KarenMalkin.com. Back with our Ask the Doctor segment after this at Sports Medicine Weekly, only on